You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, a new type of primary care. With us, we have an expert on the topic, Dr. Lalu Fayonju. Dr. Fayonju, welcome to the program.
Good to be here, Randy. Thanks so much.
Now, I have lots of questions. Now, for people that don't know Oak Street Health, like who's the typical patient? And what are the different services you provide?
So Oak Street Health is a primary care practice dedicated to the problems and the issues of helping seniors be as healthy as they can be. So we are expert, and we are the foremost provider of care for adults, older adults with chronic medical conditions. So we provide not only great primary care, but a host of other services, including behavioral health support, podiatric support, and we also have specialists embedded into our practices as well.
Okay, you know, at the top of the show, I said a different type of primary care. I've done some research, and people need to know, I'm not trying to side with you, but this literally is a different type of primary care. I think the number one thing is the physicians at Oak Street, where a typical primary care practice may deal with 2,000 patients. They're in charge of 2,000 to 3,000 patients, whereas your practitioners are seeing like 8 to 12 or 14 a day.
Right. So we are focused on really providing really in-depth, high-touch primary care to these patients. That means we keep our panel sizes much smaller, which means that we can spend more time. You know, the dose of primary care that you can give your patient really depends on the ability for you to be able to see them when they need to be seen. So if somebody has an issue, they can call up an Oak Street Center. They can be seen by their primary care provider that same day or the next day. That's really the secret sauce there, is that real ability to see our patients whenever and wherever they need to be seen.
Now, the typical primary care, and correct me if I'm wrong, the doctors may spend 15 minutes with a patient because of their workload.
Right.
And you don't have those type of restrictions.
Well,
is that right?
That's right. And part of it is because we take a team-based approach to primary care. At most, in the typical primary care setting in America today, you've got one doctor trying to do everything. At Oak Street, we've got nurses, we've got medical assistants. Okay. In the room with our providers, we have what we call our clinical information specialists, or scribes, and they're taking notes during the visit, so that rather than me trying to have to type notes and also try to understand what my patient is going through, I can just simply allow the patient to tell his or her story. And I can listen with my heart and listen with my ears to really understand what their needs are. And that way, I can really understand what their needs may be.
Now, you know, anticipating this interview today, I've done some research. I spoke to some of the other primary care physicians with Oak Street, and they went from the older model, or the model that exists today, and one of the big benefits, they said, a scribe. It sounded like this is what everybody is doing, and they're not. That means where the doctor now gets to listen to the patient and somebody else take notes.
Exactly.
That's not how it's always done.
It's not, and unfortunately, no. You know, in most primary care settings, the primary care doctor has to be on a computer, and I've seen this happen before. I see it in my own, when I am trying to get my own primary care. I've seen a situation where the provider will ask a question of a patient, but not really be looking at them when they give them that answer. So if I walk into a room and I say, Mr. Alvarez, how are you feeling today? And you look away and say, fine. That's very different. If I don't see how you answer that question, that's very different than if I'm in the computer and can't see you. But when I'm looking up,
you may just hear fine.
If I just hear fine, that's all that may be all that I actually take into that for that experience. So it's really, really important for me to be able to see you as you answer that question and not be distracted by a computer trying to put data in. So it allows you to dig deeper? Like if you said, how are you doing, Randy? And I said, fine. Absolutely. It could be the touch point for a more extended conversation about what's going on with their health, what's going on with their emotional health. You know, we work with seniors, so our patients have been seeing doctors and seeing healthcare providers for decades. And so when they come to us, it really is very important. It's very important that they be seen. And they have decades of experience and decades of lived experiences that we want to make sure that we understand fully. So if a patient comes in and says, I'm doing fine, and they seem subdued and they seem reserved, I can delve in to see, is this because maybe their diabetes is not well controlled? It's because they're lonely, or because they're dealing with depression or some other issue that we can help them in the primary care setting. So that's a real difference maker, really being able to understand and look at our patients and hear what they're saying and learn their stories.
So anybody that is eligible for Medicare is covered.
Yes,
on
so
this.
exactly. So we see anyone who's eligible for Medicare, but also folks who may be dually eligible for both Medicare and Medicaid as well.
So it sounds like anybody could go to Oak Street.
Well, actually, we focus on the care of older adults and the healthcare of specializing in the care of older people. So we really focus on folks who are 65 years and older. So if you've had 65, 64 birthdays, you can become an Oak Street patient.
Okay, so 70s, 80s, 90s. I mean, this is kind of what
I've got
you focus on.
I've got patients who are turning 100 this year. I've got patients who just turned 65, and we're really focused on that age group. But we also see some folks who are a little bit younger than that, as well as people who are quite a bit older than that as well.
So your title, Regional Medical Director, what is your role with Oak Street?
So I get the privilege of working with an outstanding group of clinicians, doctors, nurse practitioners, medical assistants, nurses, clinical information specialists, all of whom are dedicated to helping our patients live healthier, happier lives. We're also supported by social workers, behavioral health specialists. And as a regional lead, I work across many centers, ensuring that we're delivering really high quality care.
Now, how you get reimbursed as an organization.
Right.
And I was having dinner last night talking about this. The typical Medicare model, correct me if I'm wrong, is the doctor gets reimbursed based on a doctor's visit, et cetera.
Right.
You get reimbursed based on keeping them healthy or out of the hospital.
Exactly.
Is that right?
That's
Do I have
exactly.
that right?
You have
Okay.
it exactly right. So essentially, we do well and our patients do well. That means that if my patient needs to be seen by us, we have set up our structure of our practice such that I can keep them coming in. I have my patient come and see me every day. In fact, I used to see a patient who would come in every day to get an injection of insulin from us because he just did not know how to inject himself with his own insulin. And we taught him and we worked with him, but for weeks and months, we brought him in every single day. And in the end, it actually did make a huge difference because he not only learned how to take care of himself, we're actually able to help his diabetes get a lot better.
Okay.
And we did this all without having to have him go to an emergency room or go to the hospital because things got out of control. And that's really the difference. You know, when you are in a fee-for-service world, you just don't have the time to really
Like 10 or
invest
15 minutes with the doctor.
Exactly.
At the most.
It's
Is
like
that right?
in, out, you know, it's not
the doctor's fault. It's the way the system is set up.
It really is. You know, like
Okay.
we are working to kind of rebuild healthcare as it should be. And what does that mean? That means really spending time, having true longitudinal relationships with our patients. That means really knowing them for years and years and years, knowing their families, knowing the support systems around them, and building trust. Trust is really, really critical to good primary care. It's critical to every human endeavor. But I think it's something that we've maybe drifted away from as a society. But the good news is at Oak Street, we really invest in the time so we can build the trust.
Now, we're here in our studio in California, but here we have these concierge medicine doctors, and you give them about $10,000 a year, and they are like the quarterback. They'll send you to the cardiologist, they'll send you to the internist, et cetera. And we don't have anything like that here in California. But is that kind of what Oak Street is? In a way, it's like a concierge kind of medicine?
Kind of, but the good news is that our patients don't have to spend $10,000 for the benefit of
It's
enjoying
covered by
these-
Medicare.
It's
Is that
covered
right?
by Medicare.
Okay.
Folks can come in, they're seen by our team. If they're interested in becoming an Oak Street patient, we've got teams out there in our communities engaging with patients at grocery stores, at community events, and really, for lack of a better word, evangelizing about what we do. And they're going out and telling folks, hey, how can your health be better? What can we do to make your health better today versus where it was yesterday? And how can we ensure that tomorrow will even be better? And once we get folks interested in that vision, they come in, they meet our team. They meet first with what we call our patient relation manager, but in reality, they are an expert on all things Medicare and insurance. And they really help to make sure that, one, our patients are getting the most out of Medicare and out of the insurance that they have, and then ensuring that they can come and see an Oak Street provider. Once they then see that Oak Street provider, we go basically head to toe, top to bottom, making sure that we can develop a real kind of comprehensive care plan for our patients. A lot of our patients have 2, 3, 4 chronic conditions that they're dealing with at the same time. Diabetes, heart disease, COPD, depression. These things don't exist in vacuums. They're not siloed off. They all interact with one another. And it's really important to be able to talk to your patient.
How do you do it differently at Oak Street? let's say they have to see a specialist. Maybe the endocrinologist, they have type 2 diabetes.
Right.
Isn't that still a problem? Even though they get to see you in a couple of days or tomorrow if you have an opening, and usually you see them within 24 hours.
That's right.
But what if they have to see that endocrinologist?
So I'm glad you asked that. So the good news is that we now have integrated into our practice specialists who are able to give us insights about our patients within 1 hour. So the typical
a virtual,
yeah,
like
virtual. I can basically pull in the expertise of a cardiologist, an expert in heart disease, an endocrinologist, an expert in disease like diabetes or thyroid disease, and get answers back from my patient within an hour to 40 or even 45 minutes.
So it saves them a trip to going.
Saves them a trip to another doctor, saves them a trip, and with all the costs that come from going to see another doctor, it really saves our patients a ton of time, and it gives them answers faster and allows us to begin care and treatment even faster.
Now, what about medical records? Getting to that cardiologist or the other specialist?
So we have a wonderful system that allows us to be able to take our primary care information and send it to the specialist as well. The specialist is able to delve into the labs, any imaging, any information.
And you can have a live conversation on the computer with that
Basically,
specialist.
it's a back and forth conversation,
Okay.
and then I get information back, which allows me to outline what our patients need. I'll even tell you a real quick story.
Okay.
Just this past weekend, I had a patient who was recently seen in one of our centers in Cleveland. This gentleman was told that there was something wrong with his heart, but no one had ever really followed up with it. The good news, we had in our center an ultrasound system that allowed us to be able to tell how sick his heart was. I was able to call him up over the weekend, tell him a little bit about what was going on, explain how we were going to change his care, prescribe him the right kinds of medications, and then provide next steps on how we were going to continue to evaluate him and keep his heart healthy. He was really grateful for that. He said no one had ever really spent that much time really investing on a weekend, really investing in him. But this is stuff that we do not only on our weekends, but also during our working days. I just think that good care can't wait. And I wanted to make sure that I could get this information to him as quickly as possible. And I was so grateful that I had this specialist insights right there at my fingertips within minutes, so I can give him the comfort and the reassurance that he was on the right path.
I hear about like cancer centers having a care team, but you have, and I was taking some quick notes when we were talking on the phone, like 11 or 12 people. So you have the doctor, the Medicare specialist that helps them with all the paperwork.
That's right.
You have a scribe, that means somebody that's your assistant right next to you, taking notes. Social workers, mental health, PAs, medical assistant, welcome coordinator, 24/7 support, virtual specialist that you could talk to, activities director. Tell me about social workers. Why is a social worker part of primary care and important in primary care?
So there's a concept that's talked about a lot in healthcare today, the social determinants of health. That's things like access to food, access to housing, access to heat and in the winter and cool air in the summertime. That's sometimes things that we overlook in traditional Medicare and in traditional medicine. We don't usually spend the time and invest in creating the resources and ensuring that our patients have access to the resources that will ensure that they can stay healthy. Take, for example, a patient of mine recently has COPD, also needs an oxygen, needs supplemental oxygen. And one of the devices that helps this patient stay well is a nebulizer, a machine that literally aerosolizes medicine to allow him to breathe. He was having problems with paying his electrical bill. You can't take care of yourself with COPD if you don't have access to an electric, if your bills aren't being paid. So we were able to get the social worker involved, help us find ways to help him get his bills paid for, taken care of, and then we were able to ensure that he would be able to have access to his to have his nebulizer working in his home.
That's nice.
That's huge.
So, and this happens at all of your 150 plus centers, where if you need to get a social worker to help them with things like this,
exactly,
they're sent out to the house.
Yeah, so we've got a social worker right there in the center, and that social worker can ask questions right after their visit with me. With my scribe in the room with me, I can just turn to him or her and say, hey, can we bring the social worker in to see our patient after we finish? They'll have that conversation and then give, again, reassuring and building trust with that patient and ensuring that, hey, we're going to look after every aspect of this person's life.
Now, a lot of these patients, as you've informed me, that they're dealing with mental health issues, depression, anxiety. You take care of that as well.
Absolutely.
What do you do?
So a couple of things. One, we identify that the concern is there, and we provide a safe space for them to really share what they've been struggling with. You know, we've been dealing with the pandemic, and we've been dealing with the aftermath of that as well. It's really important that people recognize that a lot of people are struggling. And one of my first responsibilities is not just to think about my patient's heart and their lungs, but also their soul and their spirit. If I feel like something is going on, and if I have objective evidence to say that, hey, I think this person is depressed, the good news is I can turn to one of my behavioral health specialist colleagues and say, can we start seeing this patient regularly for some counseling? I also have the advantage of having psychiatry services built directly into our practice.
Is that right?
Exactly. So if I need to prescribe medicine, if a patient's willing to take those medicines, we can prescribe that to them and really help them to really feel well, not just feel healthy, but truly feel well.
Is it common, like a new patient, a doctor at Oak Street may spend 45 minutes with a patient?
Exactly, and that's probably the best part of the job. We really get a chance to get to know our patient from the very first visit. Our first visit with our patients is 45 minutes. We really seek to get to know them.
But that's just with the doctor.
That's just with the doctor. They've also spent time with a medical assistant who they're going to build a rapport with. They also get time with a nurse if they would like to talk to the nurse after the visit. They're also getting the chance to just know the rest of our team. So the whole team is really there to support them. They're going to come back 2 or 3 weeks later for our annual visit, and we're going to delve even deeper. We'll have spent time between the first visit and the second visit delving into that person's medical records. We'll get the records from every other place where they've gotten care up until that point, and we'll really ingest and understand that. And then we'll be able to kind of give them an executive summary to our patients, say, here are all the things that we think are issues of concern. Here's how we help. And we go through each one of those conditions with them, make sure that they understand how these conditions are affecting their lives, what steps we need to take in order to keep them healthy and happy.
What do patients say? So patients that are older patients, and they've been in primary care for quite some time on Medicare, or Medicaid and Medicare, and then they experience Oak Street. What do they say on day one? Like, what are some of their observations?
It's always one of the most gratifying parts of this job is seeing the smiles on people's faces. And sometimes even the tears that come from their eyes, tears of joy, when they recognize that they're on a demonstrably better path to better care than they were before they walked into our door. Their gratitude and the hope that they feel that now that they are on their way to getting better care.
Are they surprised that you're spending so much time with them?
They are blown away by that. They're really kind of touched by the fact that we are going to spend time. And I've had patients sometimes say, well, I've already taken up too much of your time. But I say, no. Good news is this is your time. This is your time for you and me to get to know each other and for you to get to know Oak Street and to see that difference.
You know, we talked in the green room, but you know, on that consultation, the first time you meet the patient and you're hearing their hard luck story or how confusing this whole thing has been, they've lost faith in healthcare, and sometimes you get excited. Why?
The excitement comes from the fact that they haven't seen what we can do yet. And when I'm hearing somebody tell me that, hey, I've got diabetes that I can't just cannot control, or I've been trying to quit smoking, I just cannot quit. And I just have that quiet confidence, that kind of that little secret to myself to know that, hey, once they get to know us, we're going to make a difference.
Now you have a community center. I guess you have an activities director with snacks and bingo and dancing and crafts. And one of your doctors said that they were line dancing or something with patients, computer. Is that more for just word of mouth for the community? Primarily,
it's about creating a great social network for our patients, ensuring that they have a place where they don't feel isolated, where they can feel like they're part of a community. You know, loneliness is a really, really dangerous issue in our senior population.
Okay.
Loneliness is as dangerous to the health of our patients as some chronic diseases like COPD. So isolation and loneliness is something we want to fight against. Our community rooms are really a clinical tool, as well as a community outreach tool for our patients to stay engaged with our practice, but also to stay engaged with others to stay healthier.
And again, you get your, Oak Street makes their money, so to speak, by keeping people healthy.
Exactly.
Not just based on how many they see in a day.
And isn't that how it should be?
Is that an unusual model? Because I've been asking around here in California, and that model doesn't exist that I know of.
We're really at the vanguard of what's possible in primary care. Because we are paid to take care of our patients, to provide great quality, we're really providing wellness and care around being well rather than sick care, rather than the usual reactionary way of kind of saying, well, my patient's now sick, now I need to do something. We're trying to be 1, 2, 3 steps ahead of their conditions, keeping them healthy, keeping them doing well.
And if somebody's watching this and they want to go to Oak Street, chances are within 24 hours they're going to get an appointment.
Oh, yeah.
Is that right?
We've got same day, next day visits for brand new patients. They'll get a chance to meet our team, take a look around our center, get a real sense of the community and the feel of what our centers are like. They're going to meet with a primary care provider who's going to delve in deep and really try to understand them right from the very first visit. And that really matters. That's incredibly important. You know, everything begins from the beginning, and we've got to make sure that we are really investing in that.
Somebody watching this and they're not experiencing this type of primary care, what's the process to make that change?
It's simple. Go online to our website or call our toll-free number. You can be connected with somebody within a few minutes who will get you set up with an appointment. Once you become an Oak Street patient, once you've decided to make the switch, we're going to be able to get all your medical records in. We'll be able to get all that information in so that your provider knows everything that needs to be known about you by their first or second visit.
So your team makes the calls to their former primary care.
Exactly.
And does the work for the patient.
Exactly.
So they don't really have to lift a finger if they didn't want to.
Precisely. Really easy. Really kind of simple. Once they've completed that welcome visit, it kind of triggers a process where we're ingesting information from their different specialists, from their different primary care providers, from hospital visits they've had years before, bringing all that information to them. And oftentimes, one of the best parts of this experience is that our patients learn about things they didn't even know about themselves. Information from old hospital visits, from old doctor records that I'm like, hey, I don't know if you knew that you had this. And being able to have that conversation and to explain that and teach that back to our patients and to learn the circumstances under which they got that care in the past, it really just builds their trust and it builds their growing knowledge of their own health and what their health is at this time.
And so if somebody's watching this and they want to make the change, chances are within the next 48 hours, they're at Oak Street.
Absolutely.
Really?
Absolutely. That simple.
Is this one of those things where the patients experience this type of care and they tell their friends, you got to switch to Oak Street?
Absolutely.
Does that ever happen?
It absolutely does. We have had the good fortune of not only just seeing not one spouse, but both spouses in a relationship, whole buildings, whole communities, just because one person had a great experience. And that really just has like a building effect of one great experience after the other, after the other. It's I don't want to use the word viral, but that's probably the best way I would describe it.
Is there a fee to switch over?
No fees. You know, that's the other great thing. You can go from your previous primary care provider to an Oak Street provider without any extra cost.
You have a couple of sayings that you told me on the phone that you live by. One of them was, good care can't wait.
Absolutely.
What does that mean to you?
That really means that the time is now. When we see an issue that we can help, that we can make a difference in our patients, we should move heaven and earth to make sure that our patients can get the care that they need. I've had patients who I know could have benefited from our services before we came to their community. And now that we're helping them, we're now playing catch up, but we're getting it into the right direction for their care. So I never want to delay the good care that we can give our patients. So that's really critical. The second saying that I'm often telling my patients is, if you want to go fast, go alone. But if you want to go far, go with others. We have a team at Oak Street because that really is the goal. We want to take our patients to new frontiers of where they think their health can be. And in order to get there, you need the whole Oak Street team, our providers, our social workers, our behavioral health specialists, our entire team out there helping our patients to live their best lives.
What do they like the most?
I think what strikes them most is that they suddenly feel like they're listened to, that the totality of their experiences are actually being recognized and being respected. And that care is built upon that. So they're feeling listened to, they're feeling cared for. That's really that's the thing that I think really spurs so much joy and so much excitement about becoming an Oak Street patient that they then share with their family members and their friends.
You're a regional medical director.
That's right.
Once a doctor goes from the traditional model of this fee-for-service and high volume, and they go to Oak Street, what are they most impressed about? Like, what do you hear from the doctors that make the switch to, that join Oak Street?
Our providers, whether they're doctors or nurse practitioners, I think what they recapture is the joy and the reasons why they came into medicine in the first place. They're able to really get to know their patients. They're having real relationships with their patients that they can build upon, and they're seeing the difference that Oak Street makes in our patients' lives. They're seeing their patients stay healthier. They're seeing their patients experience better living, and that's really what our goal is.
So prevention.
Absolute prevention, but
not
also,
just lip service to prevention.
Exactly, not just lip service, correct, but also ensuring that the prevention is geared towards helping our patients live better lives, fuller lives, where they're not burdened by the challenges of a chronic condition.
What do you do to get this awareness out there?
So we've got teams out there in the communities, in addition to our website and our telephone number where you can call and make an appointment. We also have teams out there in the communities we serve. They're at grocery stores, they're at senior events. At walkathons, you'll see Oak Street team members out there supporting the community and, for lack of a better term, evangelizing about what we do, spreading the good word about what Oak Street can do for our patients and for the communities we serve. And they're out there getting to know these patients and these folks, and then telling those stories back to our care teams, so that together, once that person arrives, we really know them better than they've ever been known before with their primary care provider.
Once a doctor practices primary care at Oak Street, you get a little spoiled because you have more time, right?
Yeah.
Could they go back to the old way?
Well,
could you go back to the old way?
I would not go back to the old way, and I really hope that we are the new what the future looks like in medicine. I really do believe that's what we are. I think we are rebuilding healthcare as it should be, going back to that personalized, equitable, and accountable kind of care that really ensures that people are getting the most out of their healthcare experience, building on trust, and making sure that it's a satisfying experience not only for the person providing the care, but for the person who gets the benefit of that care as well.
We are completely out of time. Final message. Somebody watching this is not the kind of primary care that they've ever heard of before. Mm-hmm. What do you say? And they're skeptical, right? Because you say most of these patients are skeptical initially.
Yeah.
What do you say to them?
Come to one of our centers. See the Oak Street difference for yourself. Come meet with one of our providers. Come meet with a team that's going to really try to make sure they understand you better than you've ever been understood before by another clinician or another medical provider, and really help us show you the difference of how you can live a healthier, happier life.
Do they ever say, like, I've never seen anything like this before? I've never experienced anything like this before?
All the time, and it's probably one of the best parts of my day.
You know, one of your doctors, in fact, we're going to have her on the program, she said, I lost my joy in medicine. I'm paraphrasing slightly. Yeah. And Oak Street gave it to me back. Where you get to literally let doctors be doctors again.
Exactly. We let our colleagues do what they have been trained to do, which is to take great care of people, giving them a free road to be able to really chart out a path for our patients and really make sure that we're really delivering this care in a thoughtful and really joyful way.
When you say the doctors, and I'm paraphrasing you slightly, but you said that they get to work at the cutting edge of their specialty. What does that mean?
So that means that they're being tasked to really use all the skills and all of the talents that they've developed over years of study and sacrifice to really understand what their patients are doing, what their patients' needs are. So we're not having them spend a whole bunch of time dealing with bureaucratic stuff that can sometimes get in the way of good care, really allowing them to focus on what our patients need. By having our scribes in the room with our patients, we're really understanding our patients, listening to them, focused on them, making great eye contact, and then doing really thorough physical exams that we can then capture and really understand our patients.
Dr. Fayadju, great to have you on the show.
Good to see you.
Appreciate
Thanks,
it.
sir.
You've been watching the Wellness Hour news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.